Some people, even after 2 weeks of having symptoms of COVID, continue to have several symptoms. Normally, the duration of symptoms is within 14 days, but if these symptoms extend beyond 14 days and sometimes even beyond 4 weeks, these people are referred to as long haulers, and this condition is referred to as long COVID. The symptoms may be myriad. There may be symptoms of dry mouth, disturbances in appetite, disturbances with sleeping. Some people are unable to sleep and some people are feeling excessively tired. They may be complaining of persistent cough, tiredness, difficulty in walking, usually with breathlessness on even minimal exertion. They may have disturbances in appetite, body aches, joint pains, disturbances in memory, loss of smell and taste, and sometimes what is called as brain fog when they are not able to concentrate. So this may be quite disturbing for most patients. The occurrence of post-COVID complications has been seen reasonably in both outpatients and patients who are hospitalized. About 30% of outpatients and 30 to 40% of patients who have been hospitalized may suffer from the infections, but it is intuitive that the longer the hospitalization, which means the more severe the illness, the greater the chances of post-COVID symptoms. This especially happens if you are older and probably have other comorbidities like diabetes and high blood pressure. People who may have a prolonged illness with severe pneumonia can have a persistent cough and breathlessness, tiredness, definitely prolonging for a longer duration. The severity of symptoms was not directly correlated with the occurrence of symptoms post-COVID, which means both outpatients with milder infections and hospitalized patients had a reasonable severe chance of developing post-COVID symptoms. But definitely age played a role, and in general, when you are male, the chances of having COVID and severe COVID is higher. So naturally, more number of men had post-COVID symptoms. The occurrence of comorbid conditions can contribute, but no specific correlation has been noticed. Most of the symptoms of post-COVID status are generally not life-threatening. Most of them may be, as I said, in the form of loss of smell, disturbance in sleeping, lack of appetite, tiredness, lack of energy. All of these may be very disturbing but may not be life-threatening. There may be situations where the person has had a very severe pneumonia with significant lung damage. This may cause the person to become breathless even on very mild exertion. In a situation like this, if the person develops a secondary infection after discharge from hospital, that can be life-threatening. Another condition which can be life-threatening is the occurrence of clots in the blood vessels, what is called as thrombosis. We all know that COVID increases the risk of blood clots, and sometimes patients who may recover from severe COVID or who may require prolonged oxygenation and may be bedridden with limited mobility may have a higher tendency to develop clots after discharge, and this, if the clot occurs in the blood vessels of the lung, what is called as pulmonary embolism, may be fatal. We have also seen the occurrences of myocardial infarctions or heart attacks and strokes due to an increased clotting tendency, which may occur 1 to 3 weeks even after discharge. Since it is very difficult to predict who may have post-COVID symptoms or who may run into complications, the general advice would be to ensure that you are well hydrated and have a balanced meal. You need to take sufficient periods of rest and sleep, but most importantly, physical exertion should be limited. When I say exertion, I don't mean walking to the toilet or going to the living room or having food. I mean starting with exercises. If you have been a fit person who's been exercising in the gym for half an hour to 45 minutes a day, it is prudent that you probably defer this after recovery for at least 2 to 4 weeks. So do not indulge in very strenuous physical activity after recovery. Take it easy. Let your body tolerate this gradual increase in physical activity before you go back to your pre-COVID times. Vaccinations, we know, do not prevent infection significantly, but definitely minimize the severity of infections and also the chances of getting complications and being hospitalized. Vaccines also significantly prevent the possibility of death. Having said this, the newer variants which we come across are probably less likely to be protected by the effects of vaccine. In spite of all these deficiencies, it is still safer to get yourself vaccinated to ensure that you minimize the complications. We are not yet clear whether vaccines will minimize the occurrence of post-COVID symptoms, but again, it is logical to think that if the severity of the condition and probably the well-being can be improved faster, the chances of lingering post-COVID symptoms can definitely be minimized by vaccinations.
Well, this brings me to the end of this video. Thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram